Thank you so much. It's a pleasure to be here today. Every time that you go to the doctor, the first thing they do is they check your temperature. But that's just the cover book. We can leverage thermal imaging to understand the thermal patterns and how our body responds to different things. That increase and decrease in blood flow can tell us many signals and signs. And we're lucky in this day and age because thermal cameras have advanced significantly. So we can leverage thermal cameras that exist in even some smartphones to better understand our human body and to move us to a proactive healthcare, a healthcare where we can intervene before things get worse, and we move from this reactive healthcare to a proactive healthcare. Throughout this talk, I'll be talking about what we've developed at Amplify, and I'll be sharing many lessons that we've learned the easy way and the hard way. And at the same time, I will be able to show you that we'll be able to create impactful healthcare solutions from Saudi Arabia and export it to the rest of the world. And the first, essentially, chapter of the thermography book that we've wrote with our solution is for diabetic foot. Unfortunately, every 20 seconds, someone around the world loses their foot. It's mostly because of diabetes. And this problem costs about $138 billion every single year in the US alone. In other places, it's actually a third of diabetes costs. If we find these problems early, we'll be able to reduce it by about 80%. The issue is we can't find it early because most of the time we don't have the specialists that allow us to come in and capture it. In many countries, we only have about 5% of the specialists that are needed to catch this problem early so we can solve it. So we went back to the drawing board at Amplify and we thought, what can we do to help solve this issue? And we developed the world's first software as a medical device for diabetic foot screening. Essentially, the way it works, we leverage third-party thermal cameras, we link it to smartphones, and the clinician will be able to take a picture. Our AI models will come in, clean this image, analyze it, and produce a report. In that report, we will tell you the risk level, what does it mean, and in the same time, we'll tell you the plan of how to fix this issue as well. So it will allow traditional or any other healthcare professionals to have that expertise for the screening early on to help solve this issue. Some tips from our journey is we started with global accelerators like Techstars and Lamarca. We have Lamarca Fuad here in the room. They've been instrumental in helping getting these ideas and bringing them to market. You need these global players to help you scale faster. In addition, we worked with the Ministry of Health where we were able to access hospitals very quickly. To develop impactful healthcare solutions, you need access to the data as fast as you can. And then joined Google Health AI Academy. And the big lessons learned there is how can we learn from others who have successfully done it to be able to learn from their lessons and scale globally, leverage and share the connections. And lastly, to bring health technologies to market, you need to have the regulatory and the rigor that's required from the Saudi FDA. And we're very thankful for the Saudi FDA because of their advancements and creating the innovative medical device pathway to allow us to get to where we want to be. Another thing you need to do to scale and create healthcare solutions is you need to publish in reputable and global academic journals. If you publish it there, it will be. This is actually the first. The first request from most clinicians is, where did you publish and what did you publish? So when you have it there, it helps a lot to move it forward. And just 2 days ago, we published with Johns Hopkins Aramco our most recent paper. Essentially, it shows that the technology is useful. We're able to use it with high sensitivity and specificity, and we are able to take 100% of the population and focus on the 10% where the issues will happen so we can pay closer attention to them. We also scaled our solution to multiple countries in the GCC. UAE, we've gotten the approval, as well as Bahrain, and soon we'll be announcing other countries, including Cameroon, South Africa, and a big announcement will come with the US very soon as well. But the big lessons learned here is obtaining Saudi FDA and the ISO standards was sufficient to be able to allow you to scale globally and bring your healthcare innovations to market. This is a quick sample of what we've done. In just 2 weeks, we've screened 1,000 people. From that 1,000 people, 10% had that issue. So we've been able to go to them and intervene before things get worse. And that allowed us to save about 6 million rials, or about 1.2 million francs, to the healthcare system, and save potentially 38 lives just by doing that screening quickly. We've deployed our solution in many places. We've only started last year. We've gotten our approval, and we've deployed it into hospitals, private clinics, public clinics, and we're working with insurance companies. And another big initiative we'll be doing this year is with pilgrimage for Hajj and Umrah, to help us expand the technology to whoever comes in and get tested with this. We've gotten many awards, including the G20 Top Innovation for Healthcare, FII Innovation Geneva, and many others. I'll announce another one soon. The core of what we're building is thermal imaging AI, and the beauty of this AI is that it can be applied to other conditions as well. So we started with diabetic foot. That was the beginning. We're able to find this problem, and it's scaling globally, and now we're moving to a second use case. In that use case, we're tackling sports medicine. In sports medicine, we've noticed that detection happens very late. So how can we go in and find the problem among players in a safe way where it doesn't impact their performance? So we're able to deploy these solutions in locker rooms or in gyms where a player can come in and get tested. And we've noticed that the English Premier League alone, on hamstring injuries alone, spend about 75 million euros every single year. So what can we do to be able to catch these early and improve the performance? So we've leveraged our solutions, and we've integrated them into a smart camera, into a smart mirror that also includes a thermal camera in it. So all what you have to do is you stand in front of that mirror. It will take your health record quickly, you complete it, and then we take the scan, and immediately within a minute you'll get the results of your injury and what can you do potentially to help in fixing it. So this will be live for the first time ever in the Riyadh Marathon next week in January 28th. Here is an example of what we're able to capture. With the naked eye, you can't see much in this image, but with the thermal imaging, you can see which knee has the problem. So we refine this further and further, and we've been able to pinpoint exactly where the issue is. You can see it in the knee. We give it a quantifiable number. That quantifiable number is critical to help in the monitoring, to see if what the athlete or the individual is doing, if it's helping or if it's not helping with their injury. And then after that, we also bring what we call the AI physiotherapist to give the recommendations on how to heal quickly and better understand the problem that you have. We're not replacing physiotherapists, but we're empowering both physiotherapists as well as the individual and the athlete with information that they may have not thought about before, or their physiotherapists that haven't, so they can go empowered to discuss all of these points with their physiotherapists. In terms of our journey and to create what we have done, you start with the technology, but technology alone is not sufficient. You can create and bring the best type of technology. You have to validate it into clinical trials, and we're happy and to say that we have the world's largest thermal data set in the solutions we're tackling. After that, you need to get the regulatory and the IP, and then get into the reimbursement. Once you solve these different points, you'll be able to scale any solution anywhere in the world. And to end this, what we've done, as I mentioned, has been scaled locally in many countries, and we expect many countries to come in this year alone. And to recognize what we've done, the World Economic Forum just awarded us with an award for the MINDS program, which means meaningful, intelligent, novel, and deployable solution. And this is just a testament that we can create solutions from Saudi Arabia that can be scaled globally and make a global impact. Thank you for your time.